Okay, hello again, everyone. This is Dr. David. Welcome to tonight's presentation. This is going to be on heart health with Jackie Harvey. I'm always almost all the time when I'm introducing Jackie, I have to stop myself. I'm calling her Dr. Jackie because she presents in such a professional and such a complete, comprehensive way. But at the same time, she makes the information easy enough for the layperson to understand. And so she really very much has done her homework. And so again, we are so fortunate to have her working with us with these webinars. And she is recruiting, she is getting an army of consultants in North America to help take the message of healthy hormones to women, especially around the world. All right, I'm going to hand, Sherry, go ahead and hand this over. I'm going to read her bio now. Jackie, okay, this is actually about her company, but let me start here. Thousands of men and women have attended Jackie's nationwide seminars. Jackie's Let's Talk seminars inform women about important issues related to hormones, including breast cancer, one of the results produced when hormones go out of balance. She shares simple strategies to restore balance to hormones, thus preventing hormone-related cancers like breast cancer. And her website is helpforhormones.com, and she does all sorts of testings, including a 5-step program and she has a hormone testing, and she has a 5-step program for maintaining hormone health, and these all provide hope to the listener. Her passion is to reach 1 million people with a message that they do not have to do drugs for the rest of their lives to bring balance to their hormones. She believes that most women and many men are not living up to their full potential because of hormonal health concerns that plague their lives. Imparting knowledge about natural approaches to health concerns is Jackie's strength, and we can testify to that. Jackie's seminars invite the attendee to be informed, consider the options, and make a health change today. Jackie produces a you can do it environment for women to create a lifestyle change and take control and responsibility for their own hormone health. And I have to say this, Jackie is a mother of 7 kids. I believe 5 of them are girls. So she knows about hormones from several different angles, from a personal perspective as well as from a professional and research perspective. So Jackie, thank you again for coming on, and thank you for being willing to impart this information to our guests. Over to you.
Well, you're very welcome, David, and it's always an honor and a privilege to be involved with Building Strength webinars. I appreciate a lot of the information that you're providing as well. I try to listen as often as I can, and I really am appreciative of those who are on the call tonight who have taken time to listen. You know, heart disease doesn't raise the interest level of people as hormone health does, or as vitamin D3 does, or as iodine does. And so I commend the people who are on the call this evening, because there is no question that this is a serious issue. I'm going to be covering just some interesting heart facts that you may not know. We'll be talking about the topic is cardiovascular disease, not really heart disease, and I'll get into that in a moment. I want to address the issue of inflammation. Dr. Lundell does an awesome job of that, and I'll be referring to some of his material. And then we're going to talk about the 3 endocrine systems that produce hormones, and I'm only going to cover 3. There are more than 3 in the endocrine system, but the 3 ones that will also affect our hormone levels and hormonal balance. And then at the end, of course, I always suggest what can we do, and then we'll do a little bit of a review, and always with these webinars we are able to do a question and answer. So let's start by talking about some of the neat things about the heart. First of all, you know, the human heart beats an average of 72 times a minute, 24 hours a day, for a total of 103,680 beats per day, 37,843,200 times per year. This little 10-ounce pump is really amazing. It starts beating 5 weeks after conception, and it never stops. At least our trust is that it doesn't stop until the day that we die. It goes without saying that the human heart is really an incredible organ. The heart moves 4 to 5 liters of blood around the body in 1 minute. Canadians and English, those in England and our visiting friends in Australia will understand liters. A liter is about the same size as an American quart. And so that's a lot of blood that little organ moves around the body. When we're exercising, it moves twice that volume. And it moves it through, as you can see on this overhead, about 100 miles of totally of blood vessels, arteries, capillaries, and veins. It's an amazing system, and it is called that. It is the cardiovascular system. So it's more correct for our topic tonight to call it cardiovascular disease than heart disease, because for the most part, it isn't the heart, that 10-ounce pump, that fails us. It is often the vascular system either leading into the heart or actually within the heart itself that causes the problem. So it's all those capillaries and arteries and veins that, that we're looking at and talking about this evening. I want to bring up this slide because, I'm always amazed at, if I were to do a live seminar on cardiovascular disease, I don't think hardly anybody would show up, simply because it doesn't seem to hold the interest. And yet, look at this graph. Cardiovascular disease skyrockets in people probably starting from 60 years old and up. One of the reasons, however, that it doesn't hold the interest of people as we move from 30 to 40 to 50 is because cancer really is affecting people younger than cardiovascular disease does. Oh, we hear of a few people who are in their 40s, mid-40s, or even in their early 50s, who all of a sudden have a sudden cardiac episode and they die. But they are rare. They are not the norm. Whereas all of us on the call have been touched by somebody who has had cancer, and cancer is affecting both men and women younger and younger. So I do understand the fact that cancer seems to get a bigger hit. We have cancer runs and walks, and we wear a pink bow on our shirts and that type of thing. But truly, out of every person who's listening on this call, 1 out of every 2 is going to die of heart disease. Some sort of cardiovascular inflammatory position is going to affect 1 out of every 2 people on this call, ultimately. And so I think, tonight it's very important to pay attention to what we're going to be saying. And the idea here is, if our heart or our cardiovascular system begins to deteriorate between 40 and 50, we ought to be looking at this to remediate it and to prevent this from happening, because I believe, as Dr. Lindell says, it is preventable. Then we ought to be looking when we are 30 and 40 and 50 into a prevention program. All right, so what's at the root of this? Well, all of our capillaries, arteries, and veins are diagrammed in approximately the same way as this is. And you'll observe that, I'll use my little marker here, that the top layer, the inside layer of the artery is the wall, and it's called the endothelium. The real problem is not often the heart itself. It is this endothelial lining that becomes inflamed. And when people have heart attacks, it's this artery that clogs. And the reason it clogs is somehow or other a little tear takes place in the artery, and then the body's instant reaction is to take some cholesterol, cover it over. Well, that makes that part of the artery wall sticky, and then other things attached to it, including blood clots. And therein lies the kind of the root beginnings of endothelial dysfunction, but also heart attacks and strokes. But not every person who suffers from endothelial dysfunction presents risk factors that are associated with, for instance, atherosclerosis or hardening of the arteries. However, every single person with atherosclerosis who is hardening of the arteries has endothelial dysfunction. In other words, there's something wrong. There's an inflammatory activity going on in the actual lining wall of the artery. So cardiovascular disease is not caused by a deficiency of drugs. It's not caused by a combination of, it is caused by a combination of genetics. You can't change your genetics, unfortunately. That's what we're born with. It's also caused, though, by inflammation, and we'll talk more about that later. It is also caused, and a major contributor factor is our poor lifestyle choices. So let's review some of those lifestyle choices. Now, these are the things that we can control. I'm not going to deal with genetics. You know, if you have somebody in your family that has had cardiovascular disease, of course you're at higher risk. You share the same genetic package. But I personally do not believe just because we have a genetic risk that we actually have to develop the disease. So I'm of the impression that there's always something that we can do, prevention. If you're like me, my mom has had 5 heart attacks. That would put me at a higher risk than the average person. And so I'm proactive. I'm becoming proactive about my own heart health. Some of the things that we can control: don't smoke. Don't excessively consume alcohol. Don't embark on a poor diet. And if you have embarked on a poor diet in the past, change it. We'll talk about some of the things that we can do later on in the call tonight. If you're, lack of exercise is a main contributor. All of these things, including obesity, are symptoms and signs that an inflammatory response could be taking place in your arteries as a result of doing these 5 things that are not healthy for you. Now, there's other things, I'm sure, but this encompasses the main things that you and I can take control of and make sure that we're accomplishing. We don't smoke, we don't overconsume alcohol, we change our diet to be a healthy diet, we exercise even 25 to 45 minutes a day, and we try to keep a normal body weight. We're going to go a long way with just doing those 5 things to stopping the inflammatory response in our cardiovascular system. Study shows that for men, for instance, and I know that the same thing is true for women, that if you have a significant waist-to-hip ratio and your BMI is too high, that you're going to be at higher risk. And that's what this article shows. Anne Louise Gittleman also says that one of the easiest cardiovascular disease tests is to simply measure your waist. And everyone can do that in the privacy of their home. Study after study after study links belly fat or visceral fat with a higher risk for cardiovascular disease and metabolic syndrome, which is a precursor of diabetes. These things all go together and encompass a risk called inflammatory process in our vascular walls. There's a new research that was printed in Obesity shows that abdominal fat is more dangerous for women than the loss of muscle mass, especially as we grow older. And so women, we need to be aware of this as well, that having belly fat is going to be detrimental to our health, particularly when it comes to heart health. And again, the reason is because it's a sign of inflammation, an inflammatory response in the artery wall. So let's talk about inflammation. Dr. Dwight Lundell was recently, I heard his heart health presentation, and he's published a really excellent book. He's going to be back on the call next Tuesday. I would encourage, now he's talking about heart attacks there, but I would encourage anyone to go on and get his previously done webinar on keys to heart health, because he's talking about inflammation. And I quote what he says: "We have done a disservice to the American or North American public. It is time to right the wrong. I will tell you quite emphatically, based on scientific fact, that cholesterol does not cause heart disease. Inflammation does." Now, what is inflammation? Well, the last time you scraped your knee, and as it healed, it started to grow warm, and it sometimes leaks pus. Well, that's all inflammation at work. So that's a positive thing that's happening in our body. So whenever there's an injury to any part of our body, the flow of blood increases as white blood cells rush to that area, and like rescue workers, those white blood cells respond as if it's a train wreck. This very process, however, can also damage tissue when inflammation becomes systemic. So what does inflammation have to do with heart disease? According to Dr. Lindell, when the lining of the artery is damaged, say with LDL particles, that's the low-density lipoprotein, which is the bad cholesterol. When those particles burrow into the artery wall, white blood cells then flock to that site, and again, if you remember that slide, it causes more plaque or cholesterol to build up to protect that break in the artery wall. How do you know if your arteries are inflamed? By testing your level of C-reactive protein. It's a CRP test, which is produced in the liver whenever inflammation occurs. So if your arteries are under attack, your C-reactive protein levels will rise, according to Dr. Lindell. So how can you tell symptom-wise if you are inflamed? Well, basically, if you have lots of aches and pains, if you suffer from congestion, if you have frequent infections or always getting a cold or developing flu, if you have diarrhea, if you have, or constipation actually, if you have indigestion, suffer from indigestion, if you have a shortness of breath, if you often feel fatigued, if you crave carbohydrates, if you have high cholesterol, your doctor has diagnosed you with high cholesterol, you've had a diagnosis of high blood pressure, if your skin breaks out in acne, if there's swelling anywhere in your body, and if you're stiff, if you have been diagnosed with elevated C-reactive protein, and if you are gaining weight or have become obese. These are all signs that there could be an inflammatory response to the artery wall. The connection here is that inflammation increases the body's ability to produce C-reactive protein. So elevated C-reactive protein is an indicator of cardiovascular disease. And the only test that I'm aware of to test whether you have an inflammation in your body is to take that CRP test. Now, fortunately, the test has really improved over the last decade, and so a lot of physicians really feel that it's an accurate test. That may not have been true at its inception, but certainly it looks like it's a very excellent way to test. And everyone on the call should at some point ask their physician to perform this test through laboratory services. So when we look at the endothelial lining again, so we see that a break again in the artery wall is what causes plaque and cholesterol to cover over and provides a little lump or an abrasion there. Basically what happens is the endothelial lining becomes impaired. It's supposed to be like Velcro, this lining. It's supposed to be smooth and nice and slippery so that nothing sticks. And when this happens, it becomes more like Velcro. This is where the inflammation begins to show up with just these tiny little gaps in the artery wall. There's something called xanthine oxidase. When I first started teaching on nutrition, I learned about xanthine oxidase, which does perforate the artery. And just for your information, pasteurized milk exudes some xanthine oxidase into the artery wall. And so we noticed a lot of inflammation in the arteries or plaque buildup after the pasteurization of milk and the homogenization of milk, even more specifically where they broke up the molecules of fat. The endothelial lining of the artery then can become impaired, and where it should be rough like Velcro, where it becomes rough like Velcro because of cholesterol and debris attaching to the artery wall, it should be smooth like Teflon, so this becomes an inflammatory response. And you know what? It is showing up in younger and younger people. We are seeing it as a problem. So let's now look and see, how does hormone connection and inflammation fit together? Well, first of all hormones are produced by the endocrine system, and as I said earlier, we're only going to cover a couple of systems. I'm going to talk about the thyroid, which would be this system here. We're going to talk about the adrenals, which are these little tiny glands that sit on top of your kidneys. And I'm going to talk about ovary and testes production of hormones, so the sex steroid hormones. Perhaps another time we'll come to the other ones, but we're going to talk about how these three glands produce hormones and sometimes malfunction with the production of hormones and cause and create and stimulate inflammation in the body that can lead to cardiovascular disease. So first of all, there is the low functioning thyroid. A sluggish thyroid produces, a variety of symptoms. The thyroid plays a huge role in heart health, and it is just that butterfly-shaped organ. It's very small, located in your throat. Now, according to Dr. Anne-Louise Gittleman, at least 20 million North Americans have some kind of thyroid disorder, and all too many go undiagnosed. Maybe we'll go back and have a look at this thyroid gland. But you can see its location. And although most stats suggest that 1 out of 8 women suffer from thyroid problems, I believe she says the number is actually higher. And as women become menopausal, this tends to even increase. And what we sometimes see in women is a little bit enlargement of this thyroid gland. That's a sure sign that there's an inflammatory process going on when it enlarges. So it produces some symptoms like shortness of breath, poor exercise tolerance. Often blood pressure is affected negatively. It will start to rise. There could be water retention or swelling. Again, bad cholesterol increases, triglycerides, C-reactive protein. Slower heart rate, premature beats, even atrial fibrillation can be placed at the feet of a thyroid gland that's not working well, and of course, ultimately, heart failure. According to Dr. Gittleman, undiagnosed hyperthyroidism doubles the risk of heart attack in women and significantly increases the risk of dying. And specifically, I'm addressing women's issues here because they seem to develop a one man to every 8 women develops this unusual under-functioning thyroid. So symptoms of a low-functioning thyroid: anxiety or depression, belly fat, coarse or thinning hair. In fact, regarding belly fat, we often feel that if a woman is having a difficult time losing weight, it could be because of her thyroid. Her thyroid may not be functioning. Coarse or thinning hair, constipation, dry skin, fatigue, foggy thinking, intolerance of temperature changes, in other words, cold hands and cold feet, joint pains and inflammation, and again, they often lose that ability to be able to lose weight. With all these assaults on the thyroid, I personally can't emphasize enough how important it is to test regularly. Now, the primary test that the physician does is going to be a TSH test. Recognize that the TSH test is, although it's a standard test, it really is simply testing the pituitary hormone effect. So it's just testing how well is your brain sending a signal to the pituitary to stimulate thyroid hormone. So it's thyroid stimulating hormone. What we want really is to have the T3 and T4 tested. And so I encourage all women and men on this call, if you're over the age of 50, get with your physician, ask him for a TSH, T3, T4 test at the minimum, and have that done once a year to make sure that your thyroid is operating optimally. Slow functioning thyroid is also responsible for the development of diabetes, and that is another cardiovascular risk. So we see a slow functioning thyroid in women that are slowly gaining weight, and I believe that personally that's easy to stop. Well, why does its function slow down? If you're eating too much soy, that can slow down your thyroid function. Overconsumption of alcohol, again, can slow down thyroid function. Taking estrogen, even when it's used simultaneously with thyroid hormones, it can short-circuit thyroid hormone therapy. Dr. Jonathan Wright says that if estrogen escalates too high, it can actually block the absorption into the receptor sites. And if, again, progesterone is too low, which is the balancing hormone to estrogen, we'll talk about that later, but if progesterone is too low, it also causes underfunctioning thyroid. So sex steroid hormones can interfere with thyroid function if they're not in balance. Stress is another huge factor, and again, low iodine. And this is where, under the low iodine category, is where inflammation comes in. We encourage women to check their iodine levels. Symptoms of low iodine are often identical to those with low thyroid function. So the two, I believe, are interchangeable. So what do we see with iodine insufficiency? Well, we see anxiety and depression. We see belly fat. We see constipation. We see foggy thinking. One of the things that tends to clear up really dramatically is the foggy thinking with women who have low iodine stores. Observationally, we can see a little bit of an enlargement in the neck for some women who have low iodine stores. Dr. David Brownstein has a great website. It's drbrownstein.com. He suggests checking your iodine levels, and he also suggests that all who are on Synthroid will likely be iodine insufficient. And so the downturning of the thyroid, according to Dr. Brownstein, is often accomplished because of low iodine initially. Now, with people thinking they might be able to get off their thyroid medication if they go on iodine, not necessarily, but certainly these symptoms can be averted. So how do we do a test? An iodine insufficiency test is easy to do. It's available from our website, healthforhormones.com. It's a urine test, so basically it's a 24-hour urine collection. The idea is that you'll take the little packet of iodine and your body should spill the majority of iodine, and that will show up in the Labrix test results. So if you're ordering a test kit from Health for Hormones, we always include a free review with one of our trained consultants. We really believe that helping our clients with the next step is an appropriate way to deal with this. And so taking an iodine test is step 2. Taking a thyroid test with your doctor is step 1. Taking an iodine test is step 2. So let's move on. The second set of organs that have a cardiovascular connection and a hormone production are the adrenal glands. And you can see them sitting up on top of the kidneys, right up there. The adrenal glands make the hormone cortisol. And, you know, the cortisol is our fight or flight hormone. It is responsible for a response to stress. Whether the stress is physical, emotional, or whether it's traumatic stress, it doesn't matter. The adrenal glands will kick in. And it can be good stress or bad stress. That's the other thing. You could be really, really happy, adrenals kick in. Really, really sad, adrenals kick in. Mad, glad, all of that. Highly stressed people are 21% more likely to suffer from high blood pressure, along with aortic stiffness, that's the aortic valve in the heart, that frequently accompanies hypertension. You know, there's a large body of research here that reveals that there's such a strong connection between chronic stress and cardiovascular disease. You know, they've done population studies that have shown that even when other risk factors are accounted for, job stress still leads to a significantly increased risk of coronary heart disease. So the job becomes a risk. The marriage puts us at risk. Our children cause us stress. There's numerous ways of having stress be produced in our body with a cortisol response from the adrenal glands. But all of this, including the high blood pressure, hypertension that's produced here, points to inflammation in the artery wall that will continue to enlarge. Cortisol regulates or modulates many of the changes that occur in the body in response to stress. You know, cortisol is actually a life-sustaining adrenal hormone, and it's essential for homeostasis, or balance, if you would. And it is truly called the stress hormone because it influences or regulates all of these responses, including when your blood sugar levels go out, when your body is not metabolizing food properly, you're not eating a balance of fats and proteins and carbs. That causes your body stress. And your body will overproduce sugar, for instance, convert to sugar if too many carbs are eaten, that type of thing. You'll hear Dr. Lundell say that overconsumption of sugar as opposed to a low-fat diet is really what we're seeing. And fat isn't the issue. He says low fat equals high sugar. So watch your sugar response for sure. Cortisol is going to produce an anti-inflammatory action when it responds to the stress that you're under. Cortisol also helps to maintain normal blood pressure. Sometimes if you're under lots of stress, your blood pressure will go sky high. It's cortisol that helps it to settle down. Your blood vessels that react and contract to stress are also controlled by cortisol, and as well as your central nervous system when it's activated. Now, according to Dr. James Wilson, who authored the book Adrenal Fatigue, all of these activities, if done over a long period of time and sustained, is going to be a problem. Short-term is not so problematic. Now, what are ideal cortisol levels? Well, our cortisol rises first thing in the morning. And it fluctuates throughout the day, but primarily it rises in the morning and then it slowly drops throughout the day. That rise in cortisol is what makes you and I feel like we want to get up in the morning. So I would suggest to our callers that if you don't feel like getting up in the morning, chances are your cortisol level is in the basement. Now, initially, all the studies talk about elevated cortisol. Cortisol reaches its highest peak 30 minutes upon waking, and then it drops down. And so when they're talking about elevated cortisol, they would be talking about cortisol levels that would be higher than, say, 20 to 30 is what we consider normal cortisol levels. Well, what we're seeing is prolonged levels of circulating cortisol that are higher do all of these negative things. I'll be very honest. By the time I see clients who do a cortisol test, usually they no longer have high circulating levels of cortisol that would produce this kind of disruption. They usually have burnt out their adrenals and actually end up with lower levels of cortisol circulating in their bloodstream. But if you look at the disruption that's caused by too much cortisol in our body, it's an amazing thing. Decreased bone density, sleep disruption, impaired cognitive function, elevated blood pressure, decreased muscle mass, on and on, immune function. I mean, it just affects so many areas of the body. This would be if our cortisol was high in response to stress. But what I find is we're starting to see low levels of circulating cortisol because when the adrenals have pumped and pumped and pumped and produced so much cortisol, they eventually start to wear out. And they cannot function at the high level that they previously were for a long period of time. So that sustained stress in your life, this is ultimately where you're going to end up with lower circulating levels of cortisol. And look at the bottom line on this is inflammation. And so we see a very strong inflammatory response with people who have been under stress for a long period of time. This is now going to have a cardiovascular impact on their body. It's going to begin to affect the endothelial lining in the artery wall. Now, it also affects things like low thyroid. It causes low thyroid. It causes the brain fog. It helps, produce that hypoglycemic sugar imbalance. Creates huge fatigue. On and on it goes. But inflammation, as it pertains now for us this evening to heart disease, is created under these low levels of circulating cortisol because we're burning out our adrenals. Studies confirm that an excess of cortisol is not good. nor is too little cortisol. There has to be a balance. There's evidence that both are of an inflammatory presence in the body. According to Dr. Ryan Stanton, medical doctor, heart disease is a symptom of low cortisol levels. Since cortisol is involved in the maintenance of proper organ functioning, your heart is affected by the lack of cortisol or poor functioning adrenal glands. And I would go to say that it's more likely it's your cardiovascular system. On the flip side, high cortisol levels are also associated with cardiovascular disease, according to Dr. Stanton. Increased cortisol will increase blood pressure and heart rate, but you can't maintain those high levels of cortisol indefinitely, and ultimately cortisol drops into the basement, and that's primarily where we see the women who we serve. To confirm true high or low cortisol levels, lab testing is required, and the most accurate test is a saliva test. It's easy to test. Basically, you spit in a tube and send the sample off. Your test results come back to you, and the test result for cortisol looks like this. It's produced in a graph. Actually, this test is a part of a hormone panel. We only test cortisol in the morning, and truthfully, cortisol levels should be up here between 20 and 30. And they all will fall, ultimately. All cortisol levels fall during the day. If your cortisol level is not high, it's not going to rise during the rest of the day significantly. And so we test AM cortisol. Again, the results can be emailed to you. And along with the cortisol test purchased from Helpful Hormones, we always offer a free consultant review for anyone who purchases through us, so that we can help you with that next step. What do you need to do next? All right, let's talk about cardiovascular disease and sex steroid hormones. And they are, although the hormone cortisol is considered a sex steroid hormone, primarily we're talking about estrogen, progesterone, and testosterone in both men and women. So let's start with the biosynthetic pathway to hormone production. I'll be talking more extensively about this March 11th for women and March 31st for men, and going into more detail about hormones and hormone function. So I'm just going to do a kind of cursory overview here, but you will notice that all hormones start and are produced from cholesterol. So cholesterol is the main building block for all the hormones that we produce. And if you go down the pathway, you'll see progesterone is produced, cortisol is produced. And so, in fact, cholesterol is necessary to be present for the production of progesterone, cortisol. Cholesterol is important to be present for the production of testosterone and estrone, estradiol, and estriol, the three forms of estrogen that are manufactured in the ovaries. So both for adrenal hormones and for hormones that are produced in the testes and the ovaries, we need cholesterol. And if you heard me doing the call on D3, we need cholesterol underneath our skin in order for our body to produce vitamin D3 as well. Cholesterol is necessary as the main building block for the production of all the hormones that are in our body. You know, cholesterol is a fat-soluble steroid from which all these hormones are made. It's important for brain function, and it's numerous other things. It helps our nervous system, and in the end, it helps produce all of the hormones that our body produces. Some people think that if they eat food with cholesterol in it, that it's going to elevate their cholesterol levels. So that's just not true. In humans, 80 to 85% of our cholesterol is actually made in our liver from sugar. And so if you have elevated cholesterol, usually it's going to be triglycerides. That's one of the three forms of cholesterol that is going to be elevated, and it's going to be because you're over-consuming sugar. 15 to 20% is synthesized from dietary fat, and you'll hear Dr. Lundell say dietary fat just is not a problem for the majority of us. It is the overconsumption of sugar that is playing havoc and causing an inflammatory response. Hormones will do that too. Dr. David Brownstein says to think about this from a different perspective. When cortisol level, or pardon me, when cholesterol levels rise, that could be a sign that our hormone levels are falling. If, in fact, cholesterol is the main building block, when our hormones start to decline, it could suggest to the body to ramp up cholesterol levels in order to make more hormones. To me, that makes perfect sense, because we find elevated cholesterol levels often in men and women who have falling levels of hormones, testosterone in men and progesterone in women. Now, men are more prone to and likely to die of heart disease compared to women of a similar age. And this study out of the University of Leicester suggests that it is the sex steroid hormones that are to blame. And I've seen numerous studies like this. And what they're saying is that our hormones are out of balance to the place where they're causing concern. And it's creating a havoc, if you would. Our sex steroid hormones are creating a havoc, and I would say contributing to inflammation that is causing increased cardiovascular disease. So let's start talking about each of the hormones. I want to go back up to the pathway for a moment. You'll see in the pathway the first hormone that's produced is progesterone. So we'll talk about progesterone first. Then we'll go and talk about testosterone. And then we'll go and talk about the estrogens. And in fact, this diagram doesn't illustrate it, but all estrogens are produced from androstenedione or from testosterone. And we'll talk about that in a moment as well. All right, so let's talk about progesterone. Progesterone, the progestation hormone. Initially, it's produced from cholesterol. It needs to be in place for the body to produce, for instance, cortisol. It is the precursor to the production of cortisol in the body. So what we sometimes find is if somebody has low levels of cortisol, we want to look at what their progesterone level is like. Often they have low progesterone. Progesterone is the anti-inflammatory hormone. It has a calming effect in the body, but it protects the tissues from estrogen excess. Estrogen can have an inflammatory effect in the body. It's a neutral hormone. It has neither male nor female attributes, but it is a precursor to all of the other hormones. So basically, if you don't have enough progesterone in your body, whether you're a man or a woman, to compete with the excess of estrogen, you could have an inflammatory response in the artery wall. And it will become ultimately a contributor of cardiovascular disease. Now, I want to talk for a moment about the difference between progesterone and progestins. Progestins are synthetic. Progesterone is bioidentical. There's only one progesterone, and that's the one that's produced by our body. When a study was done that compared non-bioidentical progesterone, which is a progestin, a synthetic form, with a progesterone that was bioidentical, so they compared the two, the amount of time that it took to produce a myocardial ischemia, which is reduced, what time does it take to reduce the blood flow in the heart on an exercise treadmill? They saw that it was substantially improved with bioidentical progesterone, not with the non-bioidentical progestin. Now, I bring that up because the Women's Health Initiative study was done and showed that using Provera, which is medroxyprogesterone acetate, or MPA, which is the primary progesterone that's on the market today, also contributed to cardiovascular problems for women in that study, and I'll come back to that in a moment. The synthetic versions of these progestins seem to be detrimental to the blood vessel walls, and the studies show that the progesterones actually disrupt that lining, that endothelial lining, and what does it do? It likely is causing an inflammation, contributing to blood clots. Now, that was a study that I found very interesting. Moving on, let's talk about testosterone. I'm not spending a lot of time on each of these hormones. If you want to know more about hormones and hormone health and how they operate in the body, come and listen in on March the 11th. Now, testosterone in men think that testosterone is, that's the male hormone. Everybody thinks it's a male hormone. There's some in both women and men for sure. Testosterone, however, is, like all sex steroid hormones, produced from cholesterol. So again, if a man goes on a cholesterol-lowering drug, chances are his testosterone is going to decline. And so, you know, I think we ought to be asking, how low should our cholesterol levels really be? I suspect that the pharmaceutical industry would like to sell more pharmaceuticals, and they would like a man's testosterone to be very low. And they want their cholesterol to be very low as well. Men want their testosterone to be very high because we want our testosterone, men's testosterone, to be in the normal range so that they feel healthy and well. And testosterone contributes to a man's sense of wellness, his verve for life. You know, a man with low testosterone levels will have fatigue issues for sure, have issues of lack of drive, and so on. You know, testosterone, in lower levels of testosterone in men are associated with conditions that lead to cardiovascular disease, and insulin resistance is one of them. But recognize that when we see lower levels of testosterone, we see elevated estrogen. Elevated estrogen in men is also considered a risk factor. We'll come to that in just a moment. There is a link between erectile dysfunction and cardiovascular disease. And again, erectile dysfunction, lack of blood flow, some endothelial lining problems, all of this goes together with an inflammatory response. Studies like this health professional follow-up study revealed that the risk factors for erectile dysfunction are really similar to those with cardiovascular disease. So all of these other symptoms play a role and can actually strongly predict sexual dysfunction in men. So can the CRP, the cardio reaction protein, or pardon me, the C-reactive protein test can also be a predictor of downline erectile dysfunction if there's too much inflammation in a man's body. What about testosterone in women? Well, testosterone, you know, a woman's body needs testosterone too. We need it in much lower amounts, however. But there's the same association. As a woman ages, her testosterone converts to estrogen as well, leaves her testosterone sometimes lower, too low as well. But what we're seeing with women, testosterone that is lower is healthier for a woman. Elevated testosterone puts her in the same position as a man with low testosterone. It reverses for us. And so it's interesting to note that in the saliva test, I've done about 8,000 or more saliva tests in the last 10 years or 15 years that I've been talking to women and men about hormones. And what we tend to see is elevated testosterone in women that are aging. And all of that testosterone is having an impact on their cardiovascular system. For one thing, it's elevating their estrogen that causes an inflammatory response. If she doesn't have enough progesterone to protect her tissues from estrogen excess, the problems just continue. We do know that these women's hormone levels are much more in balance when they are still ovulating. Things start to go awry a little bit more when they become menopausal. For men too, though, you know, there's a transition period in the mid-40s to mid-50s that we would call male menopause or andropause, and sometimes we're going to see their testosterone drop in that time frame as well. Well, let's talk about estrogen. Estrogen is thought of to be primarily a female hormone. I'll be very honest with you, we see elevated estrogen in men. In fact, when we evaluate men over 50 and women over 50, we see that men have higher estrogen levels than women do. All of these hormones, progesterone, estrogen, testosterone, are found in both men and women's bodies. It's just that in varying amounts, in different amounts. Adrenal estrogen is produced from testosterone in both men and women, and in women particularly after menopause. Adequate is the key word here. We want adequate estrogen. We don't want too much. Too much increases the clotting factor. Too little compromises our cardiovascular system and causes an inflammatory response. So too much, too little, that holds true with all of the hormones that we've mentioned this evening. This Harvard research presented a paper. It was controversial in Florence, Italy. It showed that a woman's increasing risk of heart disease is correlated to her age, not with menopause. Now, Dr. Pryor, endocrinologist at the University of British Columbia, would all concur with this. She said that, women don't need estrogen to protect their heart. The Women's Health Initiative study actually showed that that was true. Estrogen exerts a positive effect on the ability for the blood vessels to dilate and change, but even lowering levels of estrogen as a woman age would be an adequate amount to do this. And so we don't think that estrogen needs to be increased for heart health, and the studies showed that, in fact, if you do that, you put a woman's health at risk. We know from that Women's Health study that elevating estrogen beyond what it should be for the age and stage of the woman is going to put her at risk for a cardiac episode. Here's some of the information about that study. It was a 5.2-year study. They actually stopped it early, 2 years early, because the women in the study were developing breast cancer. But the other thing that was showing up is they had the double the amount of blood clots to the lungs. They had coronary heart disease. Now remember, these were women who previously had been put on hormone replacement therapy for the prevention of heart disease. It was thought that if you increased your hormone levels after menopause, you're going to prevent coronary heart risk. Well, they showed that that wasn't, in fact, true. It increased the risk for coronary heart disease, and in fact, what tends to happen with the progestins that were in that product, the Provera there, it tends to cause the arteries to spasm. Vasospasms were a high risk. Now, it also increased the risk for women to have a stroke. I think that the overall factor to look at about this Women's Health Initiative study for women who are listening to the call is the study was reflective of women primarily who were invited into the study who didn't have a risk. So the majority of women in this study had no previous risk for breast cancer, heart disease, stroke, or blood clots. And so these risks developed in less than 5 years, taking large amounts of hormones, and they were synthetically derived hormones at that. And here's basically, if you look at the bottom of this slide, this is basically the good and the bad of estrogen. Estrogen reduces the accumulation of lipids in the artery wall, but it worsens the inflammation in the wall, on the wall of the artery. So then cholesterol still has to come in, cover over the break in the artery wall, and you're going to get a susceptibility to blood clots. So the good and the bad of estrogen, it's a saw. I'm expressing to women on an ongoing basis that there is an appropriate level of hormones for your age and stage, and probably would be advisable to stay within that. Autopsies show that plaque-obstructed arteries in women are considerably less clogged than those of men, and that's probably because of the vasospasming that tends to more often happen with women. We don't tend to have the cholesterol and plaque buildup because of the elevated estrogen and the progestins that women have used. It's simply that their arteries are spasming. By contrast, men have more than 90% occlusion when they have a heart attack. So for some reason, their arteries are becoming sort of poked and prodded and responding to cholesterol more than women's are. And hormones might have that protective effect. Maintaining hormonal balance will be a key factor for this. When it comes to optimal cardiovascular health, some women may benefit from a small amount of estrogen, says Dr. Lee, but it's quite probable that for many women, and I would even say the majority of, and he calls them postmenopausal women, we call them menopausal women, the production of estrogen in the fat cells may be sufficient when supplemented with natural progesterone. So again, it is all about balance in the body. It's not certainly just about one hormone or the other. What about estrogen in men? Well, this study that was done was interesting. They studied the two forms of estrogen, estradiol and estrone. And of course, those are the two more potent forms of estrogen. And these are estrogen that are formed from testosterone. So under the influence of an aromatase enzyme, it's called, testosterone converts to estrogen in men's fat cells. So men have the highest concentrations of estrone and estradiol. They have the highest level of cardiovascular risk as well, according to this doctor. And what happened was, again, if estrogen causes an inflammatory response, you're going to get perhaps LDL cholesterol interfering with the endothelial lining in the artery. And it all comes back to that inflammation position again. Overall, I thought this OBGYN was very good. Changing levels of estrogen, progesterone, testosterone have a role to play in age-related inflammation. We still don't understand all the connections, but it appears that a decrease in estrogen corresponds with a rise in the cytokines, and those cytokines are going to be what Dr. Lundell talks about. He'll go into more detail on the mechanism there. If you want to understand that, you can order that that call from the front page of the Building Strength website. I would really encourage you to do that. All of those who got a Valentine invitation would pay a little less for those. Do sit down and watch it because he explains that well. We suspect that before menopause, the balance of hormones has a calming effect on inflammation. But hormones work on so many levels that it's difficult to identify the exact process. What we do know is that symptoms of chronic inflammation often become more apparent during and after menopause. And so for many women, their hormones tend to go out of balance. Somebody asked me the other day, why do we have elevated estrogen and why do we have to take progesterone to oppose it? My comment is we live in a world that is full of estrogen, and our bodies can only make so much progesterone. So there are foods, things that we can take that are estrogenics. The air we breathe can be full of estrogen. The water we drink, we're getting bombarded with estrogen. Dr. Lee used to say we live in a sea of estrogen that is not opposed by an adequate amount of progesterone. And so recognize that our bodies can fail us by overproducing estrogen as well. And particularly this happens for men when their testosterone levels under the influence of aromatase enzyme converts to estrogen. I guess really the bottom line is that the studies show that sex steroid hormones, estrogen, progesterone, testosterone, are associated with inflammation. And so this falls in line exactly with what Dr. Lundell is saying. Cardiovascular health is dependent, I believe, on hormone balance. And so where do we go from here? Well, I think it would be ideal to test the hormonal system. Included in this test would be a test for cortisol, but this is what a test kit looks like, and saliva testing is easy. Saliva testing is really the most accurate way to test hormone levels, estrogen, progesterone, testosterone, and cortisol. We add DHEA to that as well because it's another adrenal hormone. I didn't mention that one tonight, but certainly it is appropriate to test that. And again, anyone who purchases a saliva test from helpforhormones.com from us, we will always offer the opportunity to have a free review with one of our trained consultants. And I think that Dr. Mead sums it up. With saliva, it is possible to get a really good measure of the amount of hormones actually available to the tissues, and we term that bioavailable. This is because the hormones have to pass through the tissue to get into saliva. So hormones in blood are often bound to protein. In fact, all hormones they're lipophilic and they're protein bound often. And so really the only amount of hormone that is available to your receptor site is that which is termed bioavailable or will pass through tissue. So consequently, when you do a blood or a serum level test, it won't always give the best picture of how hormones are behaving at the tissue level. So we really believe in saliva testing. Once a person goes on a bioidentical hormone, estrogen, progesterone, testosterone, then the option for them to do saliva testing is even greater because those bioidentical hormones do not show up in a blood test. This is what a test result looks like. And again, there's a small amount of interpretations. The lab have produced for my team of men and women who are consultants a review sheet that is 2 pages long, and we go over that review sheet with our clients. It's very worthwhile endeavor to do this. So let's review hormones. They have the effect on the artery wall that basically decreases endothelial function. And the reason it does that is because it causes an inflammatory response. So when your hormones are out of balance, if your thyroid is not functioning well and you have low iodine, it can cause an inflammatory response. If your adrenals are fatigued and you're producing a low amount of cortisol, that will cause an inflammatory response. And if your estrogen and your progesterone and your testosterone are not in balance, that will contribute to an inflammatory response in the body. All this inflammation will cause and be ultimately the reason for cardiovascular disease and one of the main contributing factors. So, what can you and I do? If we want arteries that will become inflamed as that picture shows, then keep doing what you're doing. Otherwise, I think it's important to note that we need to see this and counter this chronic inflammation. You know, you've observed tonight that it takes a combination approach because it arises from a combination of causes. So it's not just one thing that is a contributing factor, and I'm sure Dr. Lundell will add more things to it. But the good news is that what I've talked about this evening, low-functioning thyroid, low-functioning adrenals, and sex steroid hormones that are out of balance, all of that can come back into your control. And from that perspective, you can prevent cardiovascular disease. I want to note a couple of things. Cholesterol-lowering drugs don't do a good job of raising the good cholesterol in the body. And, you know, if you have a take-home thing tonight, cholesterol does not cause heart disease. Inflammation in the arteries does. All right, so what can I do? We start with testing. Ask your physician for a C-reactive protein test to see if there is some inflammation happening in your body. It will show up, and the degree of it will show up with that test. Then do a saliva test and an iodine test. Iodine test to test your iodine reserves, saliva test to test your cortisol, and your estrogen, progesterone, testosterone. With these tests, you can begin to embark on a program to resolve any connection with hormones out of balance to cardiovascular disease. Then it begins to, now let's look at becoming proactive. Exercise helps to decrease inflammation. It doesn't take a lot of exercise. 25 to 45 minutes of exercise that you enjoy. I always tell people, if your exercise is a boot camp and you're overtraining, it will become another stressor and it will further compromise your adrenals, and your output of cortisol is going to decline even more. So make sure that when you're exercising, it's an enjoyable thing and it's going to contribute to overall elevation of cortisol into the normal area. Eating right. We teach eating 40-30-30. Dr. Barry Sears does an awesome job of that, and I know that Dr. Sears has spoken on a number of occasions, and I think he is going to be speaking soon on the agenda. Have a listen to what he says. He talks about eating 40% of the diet as carbs, 30% as protein, 30% as essential fats. Eating this way decreases inflammation. I want to just be a little bit more specific on that right now. 40% of the diet is carbs. Do you know that fruits, vegetables, and whole grains are all carbs? They all convert to sugar. Dr. Lundell says sugar is an inflammatory, creates an inflammatory process in our body. If that's true, then we want to make sure that we eat only good carbs. Well, fruits, vegetables, and whole grains are classified as good carbs, but they are further classified this way. The good carbs have the highest amount of fiber. The bad carbs have the lowest amount of fiber. The highest amount of fiber means that it slows up the conversion to sugar, and it actually slows up the insulin response in the body. So when you're considering 40% carbs, just know that vegetables would be first. Minimize the amount of fruit because it will convert to sugar really quickly, much more quickly than vegetables. And then whole grains. All should be high fiber supplements or high fiber foods. 30% of the diet should be protein. And that's because protein is necessary for building up muscle and for maintaining muscle mass. Protein is necessary in the diet to slow up the absorption of sugar. It stays in the body longer for digestion. 30% of the diet should include fats. Now, Dr. Lindell talks about various forms of fats. Certainly, animal fats need to make up a portion of that, vegetable fats a portion, but we need to focus on omega-3s. He's very firm about that, and there's plenty of studies. I'm not going to go into this, but there's lots of studies to show that you and I probably need to be focusing on omega-3 fats in our diet, and we ought to get the proportion of 6s and 3s correct in our diet. Find out what constitutes an omega-3 fat. There's your assignment, and start increasing them. Certainly fish oils are going to be number one in this category. And you know, the way that this imbalance of fats can be changed is to do a supplement. This imbalance is probably the main reason for the inflammatory health issues that we have today. We are not soothing our bodies with enough essential fats. I believe in supplementation with wisdom. As a result of that, I've put together a supplement company. We have very few supplements, but everything is made from a whole food. If any supplement interests you, if you want to check out our website and see if we carry it, just know that it's, number one, well made. Number two, it comes from a food source. We believe in eating a whole food diet. It makes sense to us that our supplements are not going to be produced in the chemistry lab. All right, with supplement with wisdom in mind, taking more vitamin C makes sense. We're the only animal that does not make vitamin C in our own body. If you envision a cat chasing a mouse, or a dog chasing a cat, chasing a mouse, all three of those animals make vitamin C as they're running. So the more stress they have, the more vitamin C their body needs. Stress creates the inflammatory process. Vitamin C has an anti-inflammatory effect on our body. And Dr. David Brownstein suggests 3 grams a day. Dr. James Wilson, in his book Adrenal Fatigue, suggests that you need to be taking in a ascorbate form, preferably not bonded to calcium. Again, because our body should not have more calcium. If you listen to Dr. Dougal, who talked not that long ago about vitamin D, he told everyone on the call to only consume 250 milligrams of calcium in a day. Now, Dr. Lee, who I mentored under, taught that 15 years ago. And so you want to watch the bonds with your vitamins and mineral supplements. All vitamins have to be bonded to something. Just make sure they're not bonding them to calcium. Vitamin C as an ascorbate. Ascorbate is another word for vitamin C. It's a deficiency that is a precondition and common in human cardiovascular disease. So there's studies that Dr. Matthias Rapp and Dr. Linus Pauling at the Linus Pauling Institute have done to show that a deficiency of vitamin C is a contributing factor to this inflammatory response that your body is having. So we always tell people we like what Dr. Brownstein says, we agree with what he says. Up your vitamin C. If you're not taking 3 grams a day and you're under lots of stress, you'll find it tremendously helpful. But just watch the form that you're taking. Eat a diet that's higher in fiber. Why fiber? Well, fiber helps calm the inflammatory response. Certainly, it calms the inflammatory response in the bowel. Improving fiber intake will improve bowel function. But it does other things than that. It removes excess toxins that could include sugar. So if your sugar intake is too high, this is going to be helpful. It helps remove excess cholesterol. For hormonally challenged men and women, if you have elevated testosterone, elevated estrogen, it binds to those metabolites of estrogen and testosterone and helps move them out of the body. So we set a goal of 35 to 50 milligrams of fiber a day. In that regard, we've created a fiber supplement that has been very effective in lowering hormone levels, in lowering cholesterol levels, and in calming the inflammatory response that could be a contributing factor to cardiovascular disease. eating high fiber, I mean, there are lots of studies that have been done, but with men and women who ate the most fruit fiber, they had 58% and 45% respectively less risk from dying from coronary artery disease. They did attribute it more to the fiber than to the antioxidants, but both are necessary. Make sure you have adequate vitamin D3. I did a whole call on D3, which is available at Building Strength webinars. If you would like to order it, you're more than welcome to do that. But D3 has an anti-inflammatory effect in our body. So if you want to calm the fire or the inflammation in your body, you need to improve your vitamin D3 as well. Testing for D3 is really easy. I like this lab test because you can do it in the privacy of your own home. And you know, our philosophy at Help for Hormones is in all these categories, test, don't guess. You may think that you have a problem, but maybe you don't. Maybe it isn't a problem at all. And you want to determine, first of all, a baseline and then where you're going to end later on. Most people do well with the supplements of vitamin D. You know, if your vitamin D test, as this one shows, to be 43.6, we know that the range should be somewhere over 70, probably between 80 and 100 is even better. And so keep retesting. If it's too low, keep retesting. The dosing that's suggested here was what Dr. Dougal suggested, and he suggests always to start with 5 to 10,000 kIU of vitamin D3, and then test after 3 months. And if it hasn't, you haven't brought it up enough, then do 5K and try to get it to come up a little bit higher. The maintenance dose for anybody who's reached the adequate stage for vitamin D3 is going to be about 2,000 IUs per day. A vitamin D deficiency is unrecognized, and it's emerging, however, as a cardiovascular risk factor. And more cardiologists are looking at this. I listen to so many doctors and watch so many presentations. So just kind of universally, they're suggesting that D3 supplementation is inexpensive, testing is reasonable, test and then begin to supplement. This is one way that you can really have an impact and have a degree of control on what's going on with the inflammatory process in your cardiovascular system. Even the Heart Association is suggesting that if your D3 stores are low, you're going to be 45% more likely to develop coronary artery disease. Now think about it as inflammation. It's going to happen in the artery. That's for sure. 77% more likely to die, 78% more likely to have a stroke, because whenever you develop that incision in the artery, it's going to cover over with plaque and ultimately all kinds of debris. It's going to block the artery. That causes stroke. So I think that they're all on the right track when it comes to vitamin D3. Up your amount. And you know, the thought is, if you live in the northern hemisphere of the country, and that's past the 35th parallel, which is from San Diego and north, then likely you're going to need to do some supplementation. Most of us aren't out in the sun without clothes on very often or for very long length of time. That's what it would have to take to raise our vitamin D stores. Because of the cofactors that are necessary to metabolize vitamin D, we recommend green leafy vegetables. You know, elevate your consumption. We have a supplement called Vegimax, and to our clients we have these two things go together so that they get the best absorption of vitamin D3, and we've produced it as a spray. It's a sublingual under your tongue. And last but not least is increase your arginine intake. I know that you have speakers who have talked about arginine. Dr. Elizabeth Owings is one of them. I admire her greatly. And so I'll just zero in on this a little bit, because I believe that L-arginine is also a supplement that helps to calm the inflammation in the artery. You know, L-arginine is an essential amino acid. It's present in many foods, primarily protein, and it's a precursor of nitric oxide. Nitric oxide is produced usually in the artery wall, and when the artery is compromised, when the endothelial lining is compromised, it can't produce as much nitric oxide. So supplementation can lower things like the blood pressure, because the artery wall becomes less flexible when you don't have enough arginine, and then you'll find your systolic blood pressure will start to increase. It also helps with peripheral vascular disease. We know that C-reactive protein functions as a marker of inflammation in the blood vessel, but it also can play a direct role in damaging the artery by interfering with this nitric oxide pathway. So when you take additional arginine into your diet, it helps your body produce more nitric oxide. Less nitric oxide means that the artery wall attracts more plaque. Lots of studies. There are about 50,000 studies that show that arginine, when taken in proper amounts, can stimulate nitric oxide production. So arginine becomes a really important heart health supplement. We produced one that contains 5,000 IUs of vitamin D3 as well as 5 grams of arginine per serving. We think that D3 needs to go together with L-arginine, and we put ours in a pomegranate base, which also has a hormone effect. When you're taking L-arginine as a supplement, you need to take it with a high level of antioxidant. And right now, pomegranate has a really high ORAC value, and so you know, this product is a powder. It's one of many that are on the market, but it's very good. I've listed here 22 reasons why a person should try arginine, and I'm not going to go over them, but I want to highlight a couple. It does offer good cardiac support, and people that I've observed who've increased their arginine supplementation show lower blood pressure. Their artery walls are becoming smoother, and they're actually seeing angina pain dissipate. And when they do actual artery evaluations, we're seeing a clearing up of plaque in the arteries. It helps with cholesterol control, and so then we're seeing less plaque in the artery. You'll notice number 10 says it enhances male sexual performance. L-arginine is known as the natural Viagra. I try not to get into too much on that topic. I'm the one with 7 children, and I hope you're laughing or chuckling at this point. But there's no question that it has, for both male and female sexual performance, it has a positive effect. Remember, all sexual performance is based on blood flow. And so the basic idea behind L-arginine is it improves blood flow to the extremities, including the brain. All right, I'll leave you with that. So in review, low thyroid function, basically it's low iodine stores, adrenal stress, and basically it's low cortisol causing this inflammatory response. An imbalance of estrogen, progesterone, testosterone all contribute to inflammation in the body that can lead to cardiovascular disease. And these are within your control and certainly within my control to correct. I think it's as easy as 1, 2, 3. Check your iodine levels, and if necessary, supplement with iodine. Iodine is so cheap, $10 a month for a supplement of iodine. Check your adrenal output of cortisol, especially in the morning. Take the test first thing in the morning. If your adrenal output is low, add extra vitamin C. Do some good things for yourself. Get some rest, do some enjoyable exercise, and often you can resolve your low cortisol with just those very few things. Check your sex steroid hormone levels, estrogen, progesterone, testosterone. If they are out of balance, you know, ask us for help and assistance with a program to balance your hormones. All of these things you can do, and all of these things go a long way towards reducing the inflammation in that endothelial lining of the artery wall. And if you're going to be able to do that, you're going to help reduce your risk for cardiovascular disease. Let the consultants at Help for Hormones help you. That's what we're there for. If you purchase a test kit, any test kit from us, we'll offer you a free review and assist you with the next step. I'm hoping that some of you out there are liking what you're hearing this evening and would like to become a Max Alive consultant. Who are we? We are practitioners and lay people who are advocates for balanced hormones for both men and women. We use natural alternatives to create this. I do all the training, and we provide the training to educate women to how to educate others, how to evaluate, and then how to embark on a program. So if you want more information for that, by all means, contact myself at helpforhormones@gmail.com. It's a wonderful thing when you can derive your income by helping others. You know, back to you, Dr. David. I know that this is what you are doing. You're deriving a very small income, I would say, but helping others, there's nothing like it, is there?
No, there isn't. Nothing like that. It's lots of satisfaction. But I believe too that the more you help people, like Zig Ziglar said, the more you, I guess, you will be helped as well. So we're not bothered about that.
Now, I wanted to just end with, I have a huge resource page, as I usually do, and I just, you know, I gave up on putting all the resources. Way too extensive. So along with this, if whoever wants to order this particular presentation, there'll be lots of information to look up at the end.
Oh wow, what a wealth of information. What a wealth. What a wealth. And thank you again, Jackie, for putting this together.
Well, you're very welcome. Did you learn something new, David?
Yes. As a matter of fact, this is interesting stuff. I mean, when you bring in the whole iodine and the whole arginine, and I like the way you put them all together as part of the whole cardiovascular equation. I mean, too much of the time we only think about one aspect or the other, but you're putting this all together along with the whole hormonal balance. It puts things in a much better perspective.
Well, you know, we wonder why women that went on the Women's Health Initiative study and they increased their hormone levels. Why did they develop heart disease at such a high rate? It has to be that by elevating hormone levels beyond what they should be, for the age and stage of that woman, they increase the inflammatory process.
Huh.
Isn't that something?
Right. Huh.
So, do we have anyone who has any questions?
Sure we do. Folks, go ahead and type your questions, okay? Okay, Deborah says, excellent presentation. Thank you, Deb. Of course, you know who Deb Ash is.
Yes. She buys all the presentations, doesn't she?
Oh, she does.
And the other good thing that she does is she shows them in communities. I know that she went into a health unit not that long ago. They had seen my DVD, and she showed them the presentation on breast cancer. And, you know, it was a group of nurses and individuals that just didn't know anything about this. So she is to be commended, and she is very much like all the team members that we have at Max Alive. They're just wonderful, wonderful folks.
Oh, wow. Wow. Well, Deb, thank you for spreading the word about Max Alive and Building Strength webinars. That's great. All right, we've got questions coming in, and just wanted to remind you that Jackie mentioned Dr. Lundell's presentation. It is on our homepage, buildingstrengthwebinars.com, and you can click and purchase Dr. Lundell's presentation on heart health. And Jackie recommended it earlier. Also, Jackie's series will be available on her page, and I believe Sherry put together a page of all the other presentations. Obviously, that's going to be changing in the next couple of weeks or months when Jackie does some more presentation. So lots of great resources available on for you. All right.
And it's important, David, to know for anyone who's listening, if you want to review this again, David offers these very reasonably for you to download onto your computer. So for those of you who might be new and not aware of that, if you want to listen to this presentation or any of the presentations that we have done, you're more than welcome to go to our page and purchase them for just a very nominal fee.
Excellent. Excellent. Thank you. All right. Someone wanted you to show the chart of the hormone production starting with cholesterol.
All right.
Do that.
I will have to take back and let's go back and see if I can do that.
If you right-click on it and you have the titles, you right-click on it.
Oh, I don't have the titles handy, so I have to go back like this.
Okay. Someone wants to know what form of arginine do you have?
Is that a technical question?
The good one.
You know what? If they go on to maxalive.com and go in, just click the product button or the shop button, it will take you to a product profile that will explain that.
Okay, excellent, excellent. Catherine says, excellent, Jackie. And Mary says, thank you, Jackie, great presentation. All right, what can one do to lower higher levels of cortisol that remains high all through the day?
Well, again, I have not seen the person who has high cortisol throughout the day. You know, you'd be really a revved person if that was the case. So sort of tired but wired. Phosphatidylserine is something that I've heard is very helpful. Again, vitamin C is very helpful. Again, remember that nutrients often work both ways to modulate the hormone levels. For instance, iodine helps regulate the thyroid, both hypo and hyper. And we see that with, you know, with vitamin C as well. Whether the adrenals over or under function, vitamin C is warranted.
Okay.
So, you know, and the other thing is, you know, de-stress. Now, that's talk is cheap, isn't it, David? Oh, de-stress. I have 7 children and running a business and all of that. But, you know, find time for yourself. I think that one of the things that I'm seeing in North American women is that they are stressed to the max. Mm-hmm. And so, more than anything, you'll run on that full tank for only so long, and then it will just deplete. It's like you run out of gas.
Right.
When you run out of gas, then you will have to take the time. Because, and the women that have run out of gas, they'll be on the call, and so will the men. You will not feel like getting up in the morning. So you will not have a very good cortisol reserve. Mm-hmm. At that point in time, that's when the inflammatory action starts to take place on the arteries. That's how stress has an impact on our health. And we'll develop hypertension, you know, that artery wall is expanding, contracting. I look at hypertension like a small hose that has a big bulge in it because it's got a weak area. And that weak area is produced because the endothelial lining has been under attack as a result of whatever hormones are being produced in our body or not.
I see. And it looks like quite a few people are concerned about this high cholesterol thing.
Well, high cholesterol?
I'm sorry, high cortisol, excuse me, high cortisol thing.
Well, partly because I addressed the issue of low cortisol. But remember, for everyone on the call, your cortisol only remains high for a very short period of time, and then it drops into the basement. So it has been my experience. I personally, out of 8,000 saliva tests, by the time the women come to me, I don't see high cortisol. I see low cortisol.
Really?
Yes, and it's low cortisol that causes the inflammatory response. And that means that it's long stress. Short-term stress will produce that spike of cortisol, but it will drop down into the normal range.
So all these people who are asking questions about high cortisol, if you do a saliva test on them, are you saying that you probably wouldn't find that?
Oh, it'll show up if it's been short-term stress.
Well, I don't think that's the case here. I think
if it's been long-term stress, probably what will show up is low cortisol. But hence a reason to do a test.
Right, right. So,
now the body, with having said that, the body is highly adaptive. And so sometimes I observe with women who are under lots of stress, their bodies adapt to it. And they're nourishing their body well, they're giving their body lots of vitamin C, lots of good nutrition, they're exercising appropriately. We see normal cortisol levels even when they're under stress. And that's where we want to be.
Okay, someone says she has had the saliva test and it is high all day long.
Okay, well,
I
mean, you know, I don't diagnose or prescribe, but if she wants some help, tell her to come to helpforhormones.com and send me a letter, and I'd need to see her test results and put her with a consultant, and we'll help her.
Right. Okay, that makes sense. I learned that C-reactive protein is high. That if C-reactive protein is high, not good. What level does it start to cause a problem? I guess she's asking for specific levels.
I haven't looked at the numbers recently again, so I'm not going to hazard a guess. Dr. Lindell did a good job on that, and that would be a better question for him.
Right, right.
That's a medical test, and should hear from a doctor about that one.
Good point. Good point. Okay. If you have had your thyroid radiated, then will an iodine test still work?
Absolutely. It's a fallacy to think that the thyroid is the only gland in the body that requires iodine. We've shown that breast tissue, for instance, it requires iodine. And women that develop breast cancer, one of the risk factors now is low iodine. The ovaries require iodine. The brain requires iodine. So if you only consider iodine as to supply the thyroid, you're very mistaken. The whole body needs iodine. A really good website is iodine4health.com. It's the iodine group, Dr. Fleckus, Dr. Abrahams, Dr. Brownstein, and they're doing lots of research on iodine. Iodine in the heart. You know, when your iodine stores are low, we get atrial fib.
Wow. Did not know that. Okay.
Well, what they give people who have atrial fib is amiodarone, which is that's like hitting a fly with a fly swatter the size of the room that you're sitting in. It's such potent iodine, and we would rather they used a smaller dose of iodine and use it from a better source, a natural source.
All right. Don't you think that the use of synthetic hormone replacement can have an important negative effect on the outcome of the women's health study?
Now I don't get that.
Okay. Don't you think the use of the synthetic hormone replacement had a negative effect on the outcome of the women's health study? Did you mention
Oh, absolutely. I mean, and we're supporters of bioidentical hormones only. But I'm also a supporter of Dr. Lee, who really claimed that the majority of North American women are probably never going to need estrogen because we're so subjected to estrogen. Now, the Women's Health Study was put together by a group who really went into the study figuring all women needed estrogen. And the study unequivocally proved that the health risks for going on HRT way outweighed the benefits. And so, for instance, North American Heart Association in 2002 came out and said, we reverse our position that hormone replacement therapy helps heart disease. It contributes to heart disease. Total 100% 180 on that position.
Wow.
Exactly.
Where can we find that information? Where's the website for that?
WHI, the Women's Health Initiative Study.
Okay.
Just Google it and you'll find lots.
Okay, remind us of that. Is it iodine4health.com?
Number 4.
Iodine
number 4 health. Google that too. Maybe I have that wrong, but it's the iodine group anyways.
Okay, the iodine group. So we have a vitamin D group. We have an iodine group. What else do we have?
Yes, the Vitamin D3 Council, it is.
Vitamin D3 Council, right.
These are all wonderful organizations. You know, I use them as my resource for research. They're providing people like myself with just the most wonderful resources. It's great. The internet's awesome as long as you know where you're looking. Be careful. Everybody be careful.
Right.
And you know what the woman who said about she had a 4-panel test, not all labs are testing accurately. I would just say that.
That's true.
There are five labs that I am very familiar with in North America, and I personally would only use 2 of those 5 even.
Oh.
And that's just the way things are.
So it's important to know which one to go to and which one to use.
Absolutely.
Right.
And you know, Dr. Cannell would say the same thing about vitamin D3. You just don't go anywhere to get a vitamin D3 test because You know, they showed that there was, I think on the call that the last time I did the D3 call, one of the doctors came on and said, well, do you use this particular lab? And he knew that that lab was sort of blacklisted.
Okay.
Well, you know what? We have to go with labs that are going to produce superior results, that really take their time. And we've sought out labs that do that.
That's good. That's good to know. Good to know. How does a woman with elevated testosterone with age decrease or modulate it? Now, does testosterone increase with age in women?
Well, let's think about the mechanism here. I always like to answer why first. Testosterone is produced when a woman overconsumes carbs at the expense of proteins and fats and becomes insulin resistant. How many women do you think are insulin resistant walking around this planet?
I don't know.
Well, let's narrow it down. In the United States and Canada, these women would have elevated blood sugars. They would have borderline high. They would be classified maybe in a 5 or a 6 on the fasting blood sugar. Those women, what happens when you overconsume carbs, that converts to your body in sugar, causes an insulin response, which causes your body to overproduce testosterone. Isn't that remarkable?
Wow.
So when a woman, and the same thing happens, the reverse actually happens for men. When they overconsume carbs, they have an insulin response. It diminishes their testosterone. So we tend to see men with diabetes or pre-diabetic or insulin resistant or syndrome X, men with, you know, that are have a larger girth, women that have a larger girth tend to have more testosterone produced. So in answer to her question, what do you do about that? We address it through diet, a change in the diet. Dr. Barry Sears' diet is excellent, eating 40-30-30. Improving fiber intake in the diet is necessary to slow up the intake of sugar. I mean, we have a protocol that we use with women that has been very effective in lowering testosterone levels. There's a whole drug pathway using spirolactone and metformin as well. We tend to, very hard on the liver. So, you know, we tend to suggest try a nutritional approach first, and I would be glad to help this woman if she's already received a diagnosis of elevated testosterone. You know, most women can tell if their testosterone levels are high because they've got increased facial hair, they're losing the hair on their head, and their waist is thickening. Mm. Those are 3 signs of elevated testosterone.
Mm. Mm. Interesting. You mentioned insulin resistance. Well, Barry Sears will be doing a presentation exclusively devoted to that on Tuesday.
Oh, and he's excellent.
Yes, he is. He really is. Feel blessed to have someone like that. Okay. Pete wants to know, are saliva testings also good for testing for gluten intolerance?
No. We only do sex steroid hormone testing. All right? Estrogen, progesterone, testosterone, DHEA, and cortisol with saliva right now.
Steve wants to know what are the names of the 2 best labs that I know of.
He's going to get me in trouble.
Okay.
Tell him to email me and I'll tell him.
Email. Okay, there you go. Good. Why do physicians prescribe Lipitor when you have normal cholesterol?
Yeah, isn't that interesting?
Yeah.
Because each modality of medical practitioner works exclusively. They don't work collaboratively. Mm-hmm. We've got to get this collaboration going with the whole body taken into consideration.
Right.
And you know, Dr. Lundell, his comment is cholesterol, elevated cholesterol is not the problem with cardiovascular disease, it is inflammation. Now, elevated cholesterol, according to Dr. Brownstein, reveals that hormone levels are out of balance. As soon as your body can't produce more hormones, what does it do? It tries to shove your cholesterol up. Maybe you've got not enough cholesterol. So I put this forward. I suspect that everyone who's on a cholesterol-lowering drug is going to have an imbalance of hormones, ultimately, given enough time. Mm. And I think that we're going to find, David, that cholesterol isn't the issue. Mm-hmm. My husband has had elevated cholesterol since he was 30. And that's circulating cholesterol. There's no evidence whatsoever that is attaching itself to his blood vessel walls.
Hmm.
He takes that CardioMax to have Teflon smooth endothelial lining in his arteries.
Hmm.
And when we test the endothelial lining in his arteries are supple. They're showing the age of a 50-year-old, and he's over 70.
Wow.
And that's what you want. That's what you want. But I mean, there's a price to pay. Well, my comment is you either pay the price now and do the supplement program, the nutritional program, and the exercise, along with the testing that's required, or you're going to pay it later.
That makes sense. Makes sense. What does pasteurized milk produce?
Well, it's more, I said pasteurized, but when they started to pasteurize, they heated up milk. Okay, they basically heated it. Then they homogenized it. They broke the fat molecules all up into little molecules so that the cream doesn't rise to the top. When they pasteurized and they homogenized milk, it began to produce xanthine oxidase. And you can look up that word, xanthine oxidase. It perforates the artery wall. And that began a process where cholesterol would have to cover up that perforation. And it is one of the contributing factors to plaque buildup in the arteries from consuming dairy products that are pasteurized and homogenized. So it was the processing of dairy that began to cause some problems.
Right. Okay. Pete was still asking, what supplements did you mention? You probably mentioned something for high cortisol levels.
Basically, vitamin C and phosphatidylserine for high. I mean, we don't come at it with adrenal hormones, all right? I really don't advise that at the beginning. I try nutrition, good nutrition, getting appropriate rest. And Dr. James Wilson's book, Adrenal Fatigue, is very good.
That's the title, Adrenal Fatigue?
Correct, Dr. James Wilson.
James Wilson. Okay, got it. All right.
He looked at my vitamin C product and said it was outstanding. Most vitamin Cs are going to have be made out of ascorbic acid, and you can't really take those in high doses. You need a buffered form. Just again, I'll remind everybody, make sure you don't bond it to calcium, because I agree with Dr. Dougal, and he says we shouldn't be consuming more than 250 milligrams of calcium in a day. And if all your supplements are bonded to calcium, you're going to get more than that as a supplement. And that's the wrong mineral to be bonding to.
Right. Boy, it's so important for us to be educated, isn't it?
Well, we don't live in a vacuum, that's for sure. And I think that the more information that a person has, the better decision you'll be able to make for your own health and wellness. And so this type of presentation goes a long way to putting the whole piece together.
Right. Because I just don't see this kind of information just dropping in your lap. You don't see it on TV. You probably wouldn't have your nurse or your doctor telling you these things, and so you're just pretty much going around blind.
Well, I don't think anyone's really putting all of the hormonal connection together with the heart connection, with the stress connection. I mean, there really isn't anybody, you have individual modalities working in their own areas. But I don't think they're making the connection. I would be really interested to know what Dr. Lindell thinks of this kind of a presentation.
Well,
because, he's a cardiologist. He's been focused on one aspect.
Right. Well, but he is beginning.
I like to answer why. Why?
Does he only have so much time, I guess?
Well, that's true. He's very good, though. He's really good. And he's nice and clear, and I like that about his presentations as well. Dr. Sears is a little technical, but his information is so valuable. If there's anyone on the call that wants to learn how to really eat well, that's going to be, just outstanding information.
Absolutely. And he had like 73 slides for that presentation, so he's going to approach it from every possible angle. So people want to be on that. All right. Why?
Only 73, David. All of my presentations are at least 100 slides. This one is 90 slides, and I thought, well, it's 93 or something. I thought it was small.
Oh my goodness.
All right. Well, we've had fun tonight, have we not?
We sure have. We sure have. I know the questions keep coming in, but folks, we're going to have to wrap it up here. Kay says, great info, Jackie. It's so good to feel that we have options we can use to help ourselves. So
absolutely. I agree with her 100%.
I agree.
Blessings to everyone, and thanks again, David, for having me on.
Jackie, thank you. God bless, and we'll talk later. All right, folks, have a good night. God bless. Next week is packed, absolutely packed. So you want to take advantage of the presentations that we have all lined up for you. All right, good night. God bless. Have a great weekend. Bye.